All right, thank you.
And then I will mute myself.
So we should be live right now. Good evening. This is United Medical ACO Diabetes Program. My name is Kamal Arkan. I'm the chairman of United Medical ACO. We have our program director, Amy Wilcoxon, Donna Gunkel, our director of clinical integration, and our guest tonight is Dr. Carlo Valencia from United Medical Clinic. So I'm going to go ahead and share my screen, and from that point, Amy, if you would like to take over.
All right, thank you, Kamal, and thank you, Dr. Valencia. So this is our wellness program team, and we just met Kamal and Donna. Dr. Hundle is our endocrinologist. Tim McHugh is our PT, and Jackie is our social worker. So we have twice a month on Wednesdays, and we're in our second year of this, our Wednesday wellness webinars with the diabetes program. Since we're not able to meet in person for classes, we're bringing it to you to talk about all different aspects of diabetes. So what does diabetes do to your heart, your bones, your brain, and all the different side effects of going on with that. So we present these twice a month with guest speakers to talk about all different things diabetes related. If I could have the next screen, please. And tonight, as Kamal said, we have Dr. Valencia from United Medical Clinic with us. He's going to talk about hypoglycemia. And after him, I'm going to talk about exercise with hypoglycemia and with type 1 diabetes. So Dr. Valencia, if you're ready, we'll turn it over to you.
So how does it work? Can I scroll through the slides?
Yeah, I'm going to give you access to, actually for that one, we are going to need Tanner to do that, I guess. Tanner, are you still with us?
Yes.
It doesn't give me access to it. I think you can make me host at this point, right?
Sure, just 1 second, Kamal. Okay. Should have it now.
Okay.
Okay, how does this work?
So Dr. Valencia, you should have the access right now. So I won't touch my mouse, that's the key. Okay, so you are in charge right now.
How do I go back though? Like, is there a...
If you click the arrow, the left arrow, like I'm doing it right now. So
oh, left and right. Okay. Right.
Yep.
Okay, got it. Okay. All right. So yeah, thank you for having me. You know, hypoglycemia is a interesting topic because I don't think it's something that we talk about as much as hyperglycemia, but it's as important as hyperglycemia as well, because we need to address it. So we'll start with the definition. So, you know, with sugar, it can fluctuate throughout the day. Hypoglycemia happens when a person's blood sugar level goes dangerously low and causing different signs and symptoms. In most cases, patients will need to address it, to take action to bring it back to a safer level. Most of the time, the symptoms, signs and symptoms you get from hypoglycemia happens when your blood sugar level goes less than 70 milligrams per deciliter. So what causes hypoglycemia? So most of the time, hypoglycemia happens when patient is, let's say he or she is diabetic. If she's taking too much insulin or taking certain types of medications for diabetes. Now, not all medications can cause hypoglycemia. There are certain types of medications out there that you take orally that can cause hypoglycemia. Some of the examples are Glipizide, Glyburide, Glimepiride. So they belong to a class called sulfonylureas. So, and what they usually do is they increase insulin secretion from your pancreas. So those types of medications, along with insulin, can cause hypoglycemia, especially if you're taking too much of it. Another cause is doing too much exercise without adjusting food or adjusting your insulin dose, or for those patients who do a lot of fasting and waiting between meals, and excessive alcohol consumption is also another cause of hypoglycemia. So what are the basic signs and symptoms of hypoglycemia? So signs and symptoms can vary. It can be mild, like sweating, feeling shaky, chills, irritability, dizziness. In some cases, they can progress to a more severe degree. Again, these are some of the examples: weakness, sleepiness, palpitations, tingling sensation in lips or tongue and cheeks. And if you don't address the hypoglycemia, they can also lead to a severe degree of signs and symptoms like seizure, loss of consciousness as well. So it's very important to treat hypoglycemia as soon as possible. So in most cases, patients, when they get hypoglycemic or when they get low blood sugar, they do develop symptoms. There is a condition called hypoglycemia unawareness. So that's when it happens when you do not develop early symptoms of low blood sugar. So patients with hypoglycemia unawareness do not know that they have low blood sugar. So they are unable to treat the signs and symptoms. So this is important because it puts them at risk for developing severe signs of hypoglycemia, such as seizure and loss of consciousness. So this is more commonly seen in patients who have had diabetes for a long period of time, like 5-10 years mostly, and then also seen in patients who have hypoglycemic episodes. So the more you get hypoglycemic episodes, the more at risk of you developing hypoglycemia unawareness. It's also quite common in patients who have undergo intensive treatment for their diabetes, like insulin. So a lot of times when we treat patients with insulin, in some cases they do develop these types of condition because we try to maximize the glycemic control for these patients, and in some cases they do develop these types of things. Also seen again in patients with excessive amounts of alcohol, patients who take certain types of medications such as beta blockers. So these are the atenolol, propranolol, metoprolol. So these medications can blunt the the signs and symptoms that you get from hypoglycemia. So these patients who are on these medications, they are more at risk of developing hypoglycemia unawareness. So how do you treat hypoglycemia? So when you're suspecting or when you're having symptoms of hypoglycemia, so check your sugar right away. But if you don't have any glucometer, treat the symptoms as soon as possible. One thing you can actually remember to treat the hypoglycemia is the 15-15 rule. So again, if your sugar goes below 70 milligrams per deciliter, you can take 15 grams of carbohydrates, and then after 15 minutes, you can take another serving until it goes back to at least 70 milligrams per deciliter. So some of the examples of treatment, you can use glucose tablets, like 3 to 4 glucose tablets, half a cup of juice or regular soda, 1 tablespoon of sugar, honey, or if you have any hard candies, you can use that as well. It's also important to avoid eating food high in fat, like candy bars, chocolate, cheese, because they actually slow down absorption of sugar. And in severe cases, when you're having severe hypoglycemia, patients may actually pass out and may not be able to treat themselves. So in these cases, a family member or a close friend may need to give you a dose of glucagon. What is glucagon? Glucagon is a hormone that increases your blood sugar level. and it can be injected or administered through a nasal spray. So you can give it to the upper arm, thighs, or abdomen. So it's usually very fast acting. It resolves the symptoms in about 10 to 15 minutes. Again, it's also important to avoid giving food to patients when they're not, obviously when they're not conscious, because it increases the risk of aspiration. So when they regain their consciousness, you can start giving them carbohydrates. So again, if they don't respond within 10 minutes of giving glucagon, especially after the second dose, you can call 911 and have somebody take him to the hospital. So prevention. So how do you prevent the hypoglycemia? So the best way to prevent hypoglycemia is basically to keep an eye on your sugar regularly, be familiar with the symptoms of hypoglycemia. So know your body and know how your body responds to low blood sugar. And if you are somebody who's prone to developing these episodes, it might be important to carry a quick source of carbohydrates like glucose tablets and hard candy. Again, exercise affects blood sugar. So if you're somebody who gets frequent hypoglycemia, it might be good to check your sugar before and after exercise, or during, actually, if you're having if you're undergoing a hard or prolonged session. It's also recommended to check your sugar if there is a change in your environment, like if you have a new insulin regimen, a change in work schedule, or an increase in physical activity, or if you're traveling in different time zones. So yeah, these are some of the resources. I think American Diabetes Association has a good website if you need more information. But I think Amy has some other things to talk about regarding exercise.
I do. I thank you, Dr. Valencia. I'm so glad you brought up bringing not eating chocolate, because I think, well, and one of the things you said in the beginning is that we don't talk about it enough, and I agree, because it seems to come up a lot when I'm meeting a patient for the first time, and they'll say, "Oh, I have a low," and I say, "Well, what did you do?" And it's like they've never talked about it before, and they'll say, "Well, I had a sandwich, I had a granola bar, and it didn't come up." And I'm like, "Well, of course it didn't come up if you had a sandwich." And people carry granola bars, they carry chocolate bars, things that you talked about, and they are really upset that it doesn't come up. And then they'll eat another one because it hasn't come up. And they need, I don't know if I'm sure they're getting it when they're put on insulin, but I think it's so overwhelming when you start on insulin too, that you're not getting that refresher. And then there's other meds too, like Glipizide or Glimepiride, that category. So if patients don't eat with it, and
I may have a little slow question here. Why is the name so difficult? Like for patients, for normal people, I understand for clinicians, but like today we were doing the bariatric live session, and we tried to kind of use terms that's instead of comorbidities, we say illness, just so that people can easily relate to them. So what's a better term or easier term for hyperglycemia?
Low blood sugar. So you can use low blood sugar.
Low blood.
But hypo, not hyper.
It's hypo. Yeah, correct. Hypo.
Yeah. So I think that's like, those are, to me, I think from the patient standpoint. So, well, I manage an ACO with almost 110,000 patients. And one of the things that I always hear from patient perspective is difficulties with some of our terms. So that's, I mean, I was just kind of trying to point that out, because it's much easier for patients to know, okay, I have like a low blood pressure, right? So then, and I'm not criticizing you guys. I mean, please don't get me wrong. I'm just saying that why the name is so difficult. So, but thank you for making that clear.
I do have a question before we move on, or maybe a comment. So I know, Dr. Valencia, at the beginning you were talking about some medications may cause hypoglycemia or low blood sugar. So do you think sometimes that maybe if a patient gets into a routine that they're not checking their sugar and they're just taking the same amount of medication, as a routine? I see Amy shaking her head. So that was just one of the things I wanted to bring up. And I know we talked a little bit in your presentation about making sure you check your sugar. So I guess that's an important step, is to say, test your sugar, test your sugar level prior to, so that you know how much, or whether you even should take your medication. You
Right.
don't want to put yourself into a situation where your blood sugar goes really low. So I just wanted
Right.
to maybe make sure we emphasize that.
Yeah, I think education is a big part of it. I typically remind patients, especially if they're taking those types of oral medications, that they need to take it with meals, just because the mechanism of action of that particular medication, again, it increases your insulin secretion from your pancreas. So if you take it on an empty stomach, that's really going to drop your sugar. And I've seen a lot of those cases with my patients. Same thing with insulin. So anytime you take insulin, I usually tell patients to make sure they take it with meals, or if there's any change in their diet, because we see a lot of patients doing intermittent fasting, keto diet. So sometimes there's a change in their diet. In some cases, they do develop changes in their blood sugar level, and hypoglycemia can happen in those cases.
Thank you. I just thought that was important to kind of stress that a little bit for, for our viewers, so that they understand it.
Yeah, one interesting story, because I did mention about the soda. A colleague of mine, a patient of his, went to the office, and I think he was complaining of dizziness or drowsiness. So they checked his sugar, and I think the sugar was low. So my colleague told the medical assistant to give him something, like a soda. So after 15 minutes, he checked up on the patient, and he said, "So how are we doing?" And he said, "Doc, I still feel lightheaded, and it hasn't changed." So my friend asked Emmy, "So what did you give the patient?" So apparently they gave him diet soda. So
Terrible.
so it's important to again give them something that has a quick source of carbohydrates. But that was an interesting story that a friend of mine told me.
Yeah, that is. And I don't know, Dr. Valencia, you probably hear this a lot. They did a study on people who go by feel for their blood sugar. And so, and I hear a lot, you probably, I don't know if you do too, a patient, well, I know if it's high, or if I know it's low. Yeah. And the study showed that they're not very accurate usually with going by feel. So if people who are chronically have high blood sugar and it's 100, 150, it's good, but they feel like it's low. So then they want to treat it right away, but they haven't checked it to know. So I think checking is, we had the session on the CGM because pricking your finger does get old, but. All right, you ready for me? Kamal, that was my hint. All right, is this my first slide?
I am not sure.
All right, oh, you're going forward.
Okay, so I'm going to give you the remote control. You should be in charge now.
Okay. So as we just said, many oral medications do not cause hypoglycemia or low blood sugar, with the exception of the sulfonylureas, Glyburide, Glimepiride, and Glipizide, which are oral medications that need to be taken with food. And if you take them on an empty stomach, they can cause low blood sugar. Insulin, we just talked about that, can cause low blood sugar. One of the things I think from working in pediatrics for so long that I always get upset with when I hear somebody taking their insulin, but not checking their blood sugar before the meal. So especially if it's a rapid acting that's going to work really quickly and they have no idea what their blood sugar is. So it could be 80. And they say, well, I know what it feels like, but not always. There is that unawareness. So it's important to know what it is when you're taking it. And then also knowing what type of insulin you're taking is important for exercise. All right, I'm not moving. I'm hitting the arrows, Kamal. It's not going.
Okay, so let's try one more time.
Okay.
Well, you should be able to one more time.
Yeah, no.
I think it just happened. No?
Mm-mm.
Okay, I can run.
Sorry, thank you. All right, so these are the types of insulin. Rapid acting is something that anybody with type 1 is most likely on, but people with type 2 diabetes can take it also. So this is rapid acting. This is the one that is likely to give you low blood sugar out of all of them, although Humulin and Novolin can too. So it starts working right away, 5 to 15 minutes. We see low blood sugar with this type of insulin because you might be cooking dinner, you get ready to eat, you take your insulin, then you get a phone call and you're on the phone and your insulin's working now 5 to 15 minutes and you don't eat, blood sugar is going to drop. So that's a big one. It peaks 1 to 2 hours and it lasts for 4 to 6 hours. So it's important to know if you're going to exercise, do something, how long this insulin is working in you. And if your blood sugar is going up and you think, oh, I need more insulin because my blood sugar is rising, but this insulin is still working, then you can, what's called stacking insulin, you can end up with a low. So definitely want to check blood sugar when taking Novolog, Glipizide, or Humalog, the rapid acting. Short acting are Humulin and Novolin. They don't last as long. As you can see, they last 6 to 10 hours. They peak in 2 to 4. So because they last so long, if you go, Dr. Valencia talked about intermittent fasting. So if you go long periods of time without eating, you can see lows on these blood sugar. And then Fiasp is a fast acting. So if we could have the next slide, please. Intermediate acting, Humulin, Novolin, and NPH. So even longer duration. So less likely to have lower blood sugars with intermediate and long acting, but intermediate acting does peak. So if you've got a peak of insulin and you don't have any carbs in you, then you could possibly have a low. So knowing again when your insulin is going to start working and when it's going to peak and how long it's going to last. Long acting is 24 hours, so it doesn't peak at all. I see low blood sugar with long acting when people go all day without eating or don't eat until dinner, intermittent fasting type eating, not recommended with insulin. All right, so exercise and insulin. Exercise is really, really great for people with diabetes because it increases your insulin sensitivity. So if you're a type 1, the insulin you're taking is going to work better if you're exercising. If you're type 2, your body's insulin is going to work better. It's going to type 2, there's always insulin resistance that's going to be decreased with exercise. So we want everybody to exercise. We just want you to do it safely. If you're a type 1 and you are a tennis player, you may need to adjust your insulin on the days that you play tennis because you might need less. So it's important to know how you react to your sport. Can I have the next slide, please? Thank you. So as Dr. Valencia said, check your blood sugar before exercising. So this is really important. If your blood sugar is below 70, you need to use the rule of 15 that Dr. Valencia talked about before you even get started. And then you want to know your ranges. So for some people, 80 is fantastic. They live in the 80s. 80 is really good. For some other people, anything below 100 is low. So if you live very happily at 100 and that's where your endocrinologist likes you to be and your blood sugar is 80, you should eat if you're going to go exercise. Be prepared to treat a low. So if you're at the gym and you're on the elliptical and you have a hard session and you don't have anything to eat and you're on for an hour, should you get in the car and drive home? Not without checking your blood sugar. And then being prepared to have juice, candy. Dr. Valencia gave the things to take. I really like glucose tablets because you might be really hungry and you might eat the candy when you don't have low blood sugar. So glucose tablets, they don't go bad. They're not tempting. case you want something sweet. So with type 1, there's always a lot of stress affects my blood sugar, stress affects your blood sugar. Physical stress on your body can raise your blood sugar. With type 1, stress hormones, so adrenaline, epinephrine, we can see big spikes and then drop with blood sugar. So it is important to know if you stayed up all night under a lot of stress, you're busy running around doing things, knowing what's happening to your body. So paying attention to that. If I could have, thank you. So here's our guidelines with exercise. So this is a really handy chart because you can just look at it and see what you're doing. Is it short? Is it long? Is it over an hour? If it's over an hour, check your blood sugar every hour while you're exercising. Where is your blood sugar? 80 to 150 or over 150. And then this tells you exactly how much you need to eat. And again, I'm going to give you examples of what those things are. You want to know how you react to certain foods. And then I think too, what fits in here is there's certain foods that you might not like to eat before you exercise. So you might tell me, well, I could have an apple, but I don't like to eat an apple before I exercise because it could give me reflux, or if I don't like to eat an orange because it bothers my stomach. So you want to think about what food makes you feel good before you go out and what food is going to keep your blood sugar steady. So could I have the next slide so we can go through examples? Thank you. So for the lower ones, you need 15 grams of carb plus protein. So Greek yogurt, it needs to be Greek for the protein. A handful of nuts plus 1 serving or 1 piece of fresh fruit. And that's where I was talking about knowing what type of fruit you're going to feel good on exercising. 5 Triscuits with 2 slices of cheese, 5 saltines with 2 tablespoons of peanut butter, a Kind bar, and there's so many kinds of Kind bars that you need to read your label to make sure it has 15 grams of carb plus protein. And then a soft pretzel with cheese would be, but not the giant ones, the smaller, like half ones. Those are 15 grams. So that's something that you could do. Or I'm sorry, Turkish yogurt. I just read that too. Is it Chobani? Is he from Turkey? You're muted.
Yeah, although he does it under Greek yogurt, but he is Turkish.
It is Turkish. I'm sorry. Who's correcting my slides?
It's me.
Could I have the next one, please? Thank you. So if you're longer exercise, you need the 30 grams plus protein. So a whole sandwich or wrap with proteins such as turkey, peanut butter, cheese, or tuna, a cracker pack with 2 mozzarella string cheese, Sabra hummus kit with the hummus and the pretzels, the one that comes in that container, Wawa hummus and pita wedges, Nature Valley granola bar, hard type, and you need to eat both with peanut butter. So again, knowing how you react to these foods, you might think, well, I can't eat a sandwich or wrap before I go do this workout. It's going to be too much in my stomach. So, okay, how can we get 30 grams in you? Can you eat a banana? That's 30 grams. Can you eat it with peanut butter? And that might be a better fit for you. So knowing how that fits in is a good thing. Now I'm ready for the next one. Thanks. Hydration is really important. So you want to make sure that you're drinking on the hour, every hour. 8 ounces of water, G2 or Gatorade Zero. G2 does have 5 grams of carb per 8 ounces. If you're running or doing an endurance sport, so if you're doing a triathlon or a half marathon, anything that's really long, sometimes you actually need the carbs during a regular Gatorade. So knowing what it is that you need, if you're doing something a short duration, under an hour, then G2, Powerade Zero, Gatorade Zero are sufficient. If you're taking insulin within 1 hour of exercise, you don't want to give it in the body part that you're using. So for example, if you're playing tennis, you don't necessarily want to give it in your arm. You'd want to give it more in your abdomen because you need your arms and your legs. If you're running, you don't want to give it in your legs. So you want to try to give it in a different spot. And then stopping to check every hour. This is where having a CGM, wearing something can come in because you can just watch it. It will alarm if it's low or if it's high. And then watching for delayed highs. So different things can happen during exercise. you can have a spike while you're exercising because of this adrenaline. So when I worked with ice hockey players who get really pumped up during the game and their blood sugar shoots up, and then as that goes, the game's over, all of a sudden their blood sugar bottoms out. So, and then the other thing that could happen is you're running really low with the exercise, you're drinking your Gatorade, you're eating, and then all of a sudden an hour later, your blood sugar's way up here. But typically most people have a pattern. So once you can figure out what your blood sugar runs and your preferred activity of choice, then you have an idea of most of the time how it responds. There's always going to be exceptions if you're having an off day, a high stress activity, hormones, all kinds of things can affect it. Can I have the next slide, please? Thanks. So you do want to wear an ID bracelet at all times. Ideally, somebody that you're exercising with. If it's at a gym, you might not have this, so you do want to have your ID on. If you're out for a run or playing a game with somebody, ideally somebody knows that you have, so they know what to do if anything happens. If your exercise is intense and more than 1.5 hours, you do want to eat immediately afterwards. So you want to have those glucose stores. You want to replace your glycogen stores, your glucose stores in your body. And you also want to repair the muscle that you used in exercise. So your meal afterwards should have carb and protein, and it really should be a high quality protein. So when sometimes when people will say, well, I stopped and I had a sandwich with cold cuts and cheese, and it's protein, but it's not really the best protein. So something like chicken.
I have a question here. So because you are using these intense exercise examples, so what's the typical patient, like in terms of their weight, their kind of condition? Because when I see someone exercising for 1.5 hours, I'm kind of thinking about this healthy person. Like someone who plays tennis for 2 hours, another healthy person. If you're like me, last night it was 1.5 hours, I was dying. So what's the typical patient that we are? Because from the examples that I'm seeing, what I'm getting is this may be someone who has a perfect BMI, they look perfectly, in shape, or is that not the case?
No, it's not always the case. So you could have, you could have a type 1 who weight is not necessarily going to go along with this, but you could have somebody who's not in great shape that's going to go for an hour walk, which might be intense for them, even though if you're walking with them, it could be easy for you. So when we're talking about high quality protein glycogen stores, we are talking about something more intense. But anybody on insulin, if they're on the elliptical for half an hour, they still have to take all those precautions because they still have the risk. If I'm somebody, my BMI is really high, I'm taking metformin, which doesn't cause low blood sugar, I don't have to take all those precautions, but people on insulin absolutely do. So it's not necessarily, it sounds like I'm talking about all these intense exercises, long games of tennis and running and triathlons and all of this. But really it's anybody on medication that can cause low blood sugar is at risk during exercise. So if I'm on the stationary bike and I'm working like death, then it all still counts in there.
Thank you.
So I hope that answered your question. So you do want to take proper precautions for safe exercise. And like I said, look for patterns. And you really want to have something on hand with you all the time. There are books. There's a book I use with people with type 1, Athlete's Guide to Diabetes, because it goes through each sport and talks about what's likely to happen in terms of highs and lows and what you need. People with type 2 on insulin, we still want you to exercise and we still really want you to move, but be careful. There's an older term that's not technical, a brittle diabetic, where people go like this. And we still want them to move too, but they need to be especially careful. So if they're going for a walk and that walk might cause them to be low, they need to check ahead of time to see where they are. If it's a 10-minute walk, it's probably not going to make them low. I think Dr. Valenci addressed probably one of the biggest misconceptions, which is what to use to treat low blood sugar. Because I probably hear it at least twice, 3-4 times a week on people who are not properly treating low blood sugar, that they're using sandwiches or cheese or chocolate or brownies, things that they know will raise their blood sugar, but they don't realize they need something to raise it immediately because it is an urgent problem. It's Dr. Valencia talked about all of the severe side effects that can come along with low blood sugar. I think that was my last slide. Yes. Okay.
So, I mean, I think it's really important to understand. I mean, what I'm hearing from you, both of you, is that not understanding the food and which selection of the food that we need to have when it's low. I wonder if there are ways to maybe we can make this more visual for them so they can see exactly what they should be eating. Even for like in our exam rooms or waiting rooms, now we do a lot of telemedicine, just so then for patients to kind of see not having the chocolates, like a big X on chocolate and then low blood pressure next to it. So.
It's a good, I used to keep in my office when we were in, it's probably still in there. I have a Ziploc bag with a can of Coke and some Smarties and some Skittles to show exactly this is what you're supposed to use. The other thing too that I don't know if we talked about that people don't realize is if they have a low blood sugar and they do treat it properly with candy or sugar, that they need to, once it comes up, they need to eat something with protein, because it will just drop back down again. So if I'm out and about, I have a low, I take my glucose tablets, I check again, okay, it's 80, I'm good. I keep doing what I'm doing. I still have insulin in me. And those fast acting, they bring it up fast, but the insulin is just gonna go right back down. So I think if we do have that visual, which I know I have them in handout form, just not posted, of what to do, of taking that 15 grams and then follow it up with a meal.
So the other thing that we do have, Amy, is the quick tip video. So we do have a visual.
Yes, we do have a video on that.
Right. Last year we did a series of quick tip videos. So I just wanted to put a plug in for that. Out on our YouTube channel, United Medical LLC, or on our website, we have a number of quick tip videos. It's like 5 minutes. And Amy walks you through, and she has her little bag. So it tells you how to treat low blood sugar. So we have a number of other quick tip videos, and we're doing a new series this year on mindful eating. We have another one that will be coming out soon on a cooking demonstration. And then what was the third one, Amy?
Meal prep.
Meal prep and planning. So again, that can help you overall. But I just wanted to mention a few of those because we worked really hard to make those available for our patients.
Yes, I'm glad you brought that up. We do have a visual. We have a quick tip video on how to treat it.
Actually, I'm going to bring one of them up. And by the way, whatever you guys are hearing from the background, that's not me, that's Buddy. So he's heavily breathing right next to me. So this is on United Medical channel. And this is one of the latest that we have.
Of our nutrition and diabetes program. I'm here to resume our quick tip video series, now we're in 2021, and we're going to start today with talking about mindful eating.
Yeah, that was our teaser that we put out there just to remind everyone of the series. But actually, it is it looks like it's the fourth one across, how to treat low blood sugar.
Is this funny?
No, if you go
Oh,
down,
yeah, that's from last year. Yeah.
right, the fourth one across is how to treat low blood sugar. So it is the one that we just
That's
were.
it.
My name is Amy Wilcoxon with the United Medical ACO, here to talk to you today about how to treat low blood sugar.
So
So take 15 grams
this
of
is
fast-acting sugar.
this is very helpful for our patients, at least in my opinion, for them to be able to watch those whenever they need, they can, in their own convenience. So at their own convenience. So do we have other questions?
I like the video, like Martha Stewart there.
Oh. Okay. Yeah, the apron was new this year.
Yeah, so it's good for you too, Dr. Valencia, your patients. I mean, sometimes I know they don't want to see the dietitian, but they can get a lot of benefits from the quick tip videos from this series that we're doing on the Wednesday nights. And then we have our handouts out there. So if they go to our website, we have under the diabetes program, all of those resources very readily available for them.
Yeah.
Yeah, and one with meal ideas, which I know a lot of times they just want somebody like to tell them what to eat. So we have that on there too.
Right, it gives them a
used to
lot
be
of
the big
ideas for
request.
breakfast, for lunch, for dinner, for snacks, the 100-calorie snack tips. So there are a lot of resources there for them.
What's the website again?
It's our umusa.net. And then if you go under for patients, then it says wellness programs, and it has the diabetes program, and we have all of those resources right there.
Actually, yeah, I'm going to show that right now. So then for those patients who may not be aware of that. So this is from United Medical website, umusa.net for patients, and then under the wellness program.
Yes.
And there are 5 main programs we have right now. And diabetes and nutrition education. And here's the program, and under
So you'll see at the top, we have the handouts. That's what Amy was referring to. So they can print those out. They have, like I mentioned, the 100-calorie snack list. They have meal planning guide. They have a lot of different things. We have the quick tips. If you click on each one,
and
it
the
will
videos
take
are
you.
here as well.
And then below that are the wellness webinars, and we have them listed by topic.
Well, you mentioned something. I mean, you actually didn't mention, but you say something, so I do want to make a correction. Everyone wants to see our dietitians and nutritionists. In fact, we cannot find a spot for them right now, so I have to kind of ask them to pick up some extra time. So, especially with telemedicine, I think it did increase our compliance rate. I think patients do feel. One of the, Dr. Valencia, actually, maybe I'll ask you this. I mean, Amy and I, we talked about this before, but I think from the COVID pandemic, one of the biggest silver lining for us is utilization of the telemedicine. In fact, actually, last week when we had the snow day, you guys already made your, you didn't have to make a huge change on your schedule because most of the patients were already on telemedicine. But I see also the increases on the compliance, meaning like less no-show, less cancellation on nutrition and diabetes visits. So is that the experience that you see on your side with telemedicine?
Yeah, I mean, again, I usually tell patients to utilize telemedicine, and especially for those instances where they can't physically be in the office. It's a big help for our patients.
I mean, because like even for Amy, our follow-up visits are 30 minutes, right?
For the most part, sometimes they're longer. Yeah.
So what I was going to say is that if I let's say if I have a full-time job, let's say if I work at a bank, so in order to make that 30 minutes in the past, I had to leave my job earlier give myself enough time, not sure what time I was going to be seen, and then maybe I needed to come back. So like something that's going to take 30 minutes used to take easily minimum 2 hours. Now I think that increased those people who were having difficulties, and now we are able to actually see more compliance from the patients. So I'm hoping that we can keep this for the future and make it more convenient for the patients.
You're absolutely right, Kamal, because a lot of times, even now, when we're scheduling the patients, they will tell us when they have a break at work, and they'll actually just leave the building sometimes or close the door to their office, and they'll go out in the car and they'll do the, face-to-face video with their dietitian. So I didn't want it to sound like, nobody wants to come see them. Trust me, we're scheduling about 2 months out. So everybody really wants to, but occasionally
I have to give you a hard time.
On
So
a piece of paper. But yes, we are scheduling in April right now. But that is a good point. And I think it does make it easier for patients because they're not having to take time off from work.
Or get childcare too.
Right, or childcare. And they can do the visit, much more conveniently in their car, in their home. I know our dietitians have pointed out sometimes it's easier because a patient may not remember something that they're eating, and they're like, it's in the blue can. And I know the dietitians say, well, walk me over to your, cupboard and show me what it is. So now the patients have the ability to, show the refrigerator, show their cabinet, show what foods they're talking about. They can help them read the labels. So there are a lot of other advantages as well.
So maybe, Amy, we should do a session with that so I can show you my fridge.
I mean, I've been known I pull things out of my fridge. They'll say, well, what's that yogurt? And I say, here, this is the yogurt I want you to eat. And I pull it out of the fridge and I show them.
We can definitely do that. It will be more fun.
That could be another one of our webinars, exploring Kamal's refrigerator from a dietitian standpoint.
That should be interesting.
There's not much actually. I don't keep them in the fridge. All right, well, guys, thank you so much. I know it's late for all of you. You had a long day, and I do appreciate for everyone taking time and making this possible. Dr. Valencia, thank you again.
Thank you.
Yes, today, and Amy, Donna, thank you, and I will talk to you guys later. And we'll have our session. This was our second one for this month. So the second and fourth Wednesday every month will be back, other than our other events.
So March 10th, Dr. Hundel will be talking about it's beyond the basics. So now we've talked about what is diabetes and what are the meds. He's going to talk about some other more advanced topics, things you should know. And I'll be talking about the same things. What does extra fat do to your blood sugar? Not on the body, but extra dietary fat like keto. What does extra protein do? And all these new fancy foods. What does it do to your blood sugar?
Amy, I'll share something with you so you would like to hear this. I got 2 messages from 2 different medical students. They were utilizing some of our sessions as a learning point.
Wow.
I was extremely happy to hear that.
That's great.
Well, thank you again, guys. Good night and be safe.
Thank you.
Thank you.